Good morning, guys. Today we are talking about an important topic about why do we need two sessions of transplant. So, what are the stipulated reasons or demanding reasons one should go with the second session? That's what we are going to discuss today. We have a live patient to discuss all these details to understand why one person requires second session of transplant. Kindly watch the video until end to understand those stipulated or demanding reasons to go for second session. We already know about this large scalp like class 5 baldness, class 6 baldness, and even fair skin. These guys always need a second session. Apart from this, one more important reason or factor is kind of a quality and quantity of the grafts. That's very important aspect. So, how does this quality and quantity affects our plan, our design, or execution, and where that patient needs second session? In this patient, actually, this patient when we examined during the consultation for visuals, the donor was looking almost above average, almost good. But when it comes to the practical day, I mean, on the sense of surgery day, so when we try to harvest the grafts, the quantity also very good. So quantity means number of the grafts. The quality means how best quality these grafts are there. So when we harvested, then 2,700 grafts we could able to harvest. The quantity wise we are happy, but what makes us to a little change in the plan was quality of the grafts. So quality means in this patient a simpler man, a simpler reason. This guy had lot many single follicular units. Out of 2,700 grafts, we got lot many single follicular units. That is the reason we redesigned a little bit change in the plan for this patient to get better camouflage in first session, and we plan some area in second session also. Now here, because this man has a little low quality on grafts, that means having a more single follicular units, we took little higher hairline and we could able to implant in only 65 to 70% of the area. Other area, crown area, he has to come for the second session. And that's the plan to this patient because of the quality of the grafts. Before transplant, we had shown you the donor. We got almost 2,700 grafts. Why I am showing this is this patient had kind of more single follicles. Though donor was looking great yesterday, though we got 2,700 number, but lot many singles were there. With that 2,700 grafts having more singles, what we covered is, so this much we could able to cover in this patient. I'm sure we need to cover more in crown area. That's for second session. That's the importance of understanding donor assessment, planning, and how we execute the transplantation. So here, frontal area we did more grafts, and crown area we did not do because though number is more, but a lot many single grafts are there. It's not a good idea to implant all over the scalp. So we just covered almost, and we have taken a higher hairline, and we covered almost 60% to 70% of the scalp area. That's the ideal actually. And if you can see, harvestation has been done all the areas, and that's the back side, even side also. We harvested all the grafts. So probably some people have questions, why can't you harvest more grafts? But kindly remember, we harvested the maximum grafts within safe donor limit. Though we achieved and we harvested, we got only 2,700 grafts. That's the number we should understand. And with that number, because there are many single follicular units, we cannot cover everywhere. Crown area, we did not cover it. So this is the practical thing one should understand. And if you can understand this, why we need to plan in two sessions, we'll understand in a better manner. If you can see this crown area, probably we are planning second session, and maybe after a minimum gap of 6 months. Yeah, this is the donor second day. Why I'm showing this is, if you can observe the yesterday's before surgery donor, you can get an idea. Donor was looking great. Whereas on examination and while doing the procedure, we got 2,700 grams, and there were a lot many single follicular units were there. See, we harvested all the safe donor area, maximum grafts. Why I'm showing this is, there are a few guys will ask me, why can't you harvest 3,500 grafts, or why can't you target 4,000 grafts? This I'm showing you to understand we could only achieve or harvest only 2,700 grafts just because donor was not that great, though it was looking great in the photos. That's the idea of showing this donor in second day. Now, if you ask me a question, how can we do second time a few more grafts? I'm sure there are a few more grafts are there in between that can be harvestable after 6 months gap. Minimum gap is 6 to 7 months, and now we cannot do it. If you do same day more than that, definitely you're going to damage the donor. And that is the idea of doing 2 sessions in class 5 or class 6 baldness. Conclusion of this kind of cases is basically, well, this patient is a class 6 baldness, that's okay, you would always need second session. But in few patients like kind of class 3 or class 4 baldness where is supposed to get good density in one session, suppose those patient has quality low grafts, definitely would need second session. That's the conclusion, because this is the important factor, stipulated factor, demanding factor that leads to second session. One should try to understand this factor, because on visual examination probably we would not know that. When you come for the surgery on the harvestation day, we'll understand what kind of quality grafts you would get it, and these kind of patients would need second session. That's the conclusion. Thank you.